Hello, thank you for your interest in our presentation. I'm Jen Keith. I use the she and her pronouns, and I'm from the Research and Evaluation Group at Public Health Management Corporation. We're a large nonprofit in Philadelphia, and today I'll be presenting work on behalf of a team, including folks from Bradbury-Sullivan, LGBT Community Center, the Pennsylvania Department of Health, and of course the Research and Evaluation Group at PHMC. We're going to be focusing today on data that we've collected in 2022 for the LGBTQ Health Needs Assessment in Pennsylvania. These data were collected, and we share these data as much as we can with the goal to support health equity action. Surveillance tools are not yet fully inclusive for LGBTQ communities, and leaving LGBTQ communities at risk for being ignored or deprioritized when those data are not available. Experiences with discrimination, minority stress, homophobia, transphobia, and the tobacco industry targeting are some of the factors contributing to health disparities and barriers to health care experienced by the LGBTQ communities. With this biennial needs assessment, we seek to identify health needs of a historically marginalized population in Pennsylvania so that we can create data-informed public policy, programming, and proposals. So you'll see this work started in 2015, 2016 with regional assessments, and we've moved in 2018, 2020, and 2022. We've done statewide assessments. In 2022, which is where we'll focus today, we had over 4,220 respondents. We collect information on a variety of health topics, including experiences with healthcare providers, mental health, substance use, tobacco use, cancer, sexual health, financial security, and others. These data are always made available to researchers, healthcare providers, government agencies, and of course, most importantly, the LGBTQ community. The needs assessment itself has been open. It was open in spring of 2022 for a 10.5-week period. Was available online and in English and Spanish versions. It was available for completion by anyone who identifies as LGBTQ, age 13 and over, residing in Pennsylvania. This is a purposive, convenient snowball style sample that has been supported by over 40 LGBTQ focused organizations. We ask demographic questions, including gender identity and sexual orientation questions, sometimes called SOGI questions. We ask about race and ethnicity and lots of different demographics. All of that is important and helps us to understand health disparities within LGBTQ communities as well. For the first time in 2022, we were able to ask questions about identifying as someone who lives with a disability and identifying as neurodivergent or a person on the autism spectrum. When we ask questions about basic needs, we can think about things like homelessness and, again, looking at some of the disparities within the LGBTQ community regarding who has experienced homelessness in their lifetimes. When we think about other basic needs and access to funding and worry about food, we also can look at that and think about overall how folks are doing, and then within the LGBTQ community who may be more at risk. There's lots of questions about general health, as you would imagine, and I'll point out two that are on this slide. Nearly 5 in 10 respondents fear seeking healthcare services because of past or potential negative reactions from healthcare providers. This is really important as we think about access and trusted sources of information and where folks may feel most comfortable receiving services. Also, some really important news about resiliency. 96%, or almost all of our respondents, have some interest in healthy living strategies like healthy eating or ending tobacco use. One of the things we talk about is discrimination and healthcare provider interactions. We have found that almost a third of our respondents have experienced a negative reaction from a healthcare provider when they learned they were LGBTQ. This is exacerbated for several demographic groups within the LGBTQ community. This information is really important to share back with healthcare providers while trainings are being developed and communication for healthcare providers are prepared. We also ask respondents about priorities that they see for their communities. And similar to prior years, in 2022, the most common community priorities were related to mental health. Tobacco use is always something that we have looked at, and we found that certain demographic groups and geographic areas were at higher risk. We see that most respondents have interest in quitting tobacco use at some point in the future, but we see for a variety of reasons and circumstances, including tobacco industry targeting, marketing tactics, and high tobacco availability in lower income and Black and brown neighborhoods, smoking rates across different demographics demonstrate really alarming tobacco use disparity. So in summary, there's a lot of resiliency, there's a lot of challenges. We need to keep collecting information and seeking information from LGBTQ folks themselves. The report has many recommendations. You're welcome to view it. Here's our authors, folks we'd like to thank, and the full report availability. Thank you.